PICCOLETO II is a GISA-sponsored study. It is an investigator-driven study, multi-center randomized clinical study of comparison between Eluting, also called Emperor in some countries, and Xyens in a small vessel disease setting, which means vessels up to 2.75. Well, when we designed the PICCOLETO II study, we hypothesized the non-inferiority of this DCB, eluting paclitaxel versus Xyens. And we were really surprised in finding and in seeing the results of the core lab analysis of the primary endpoint, which is late tumor loss, because in segment and in lesion, late tumor loss showed the superiority of this device as compared to the best-in-class drug-eluting stents, namely Xyens. The differences with PICCOLETO II is that the PICCOLETO II is a study whose primary endpoint is clinical, a surrogate endpoint, putting together different endpoints, namely MACE, Major Adverse Cardiovascular Events. So the study is larger. However, the comparison arm was made of 75% of the cases with Xyens, but 25% with Taxus and the paclitaxel eluting stent. So this is a little bit confusing. There are two big studies, two important studies, both of them showing at least the non-inferiority or even the angiographic superiority, like the PICCOLETO II study of drug-coated balloon in a small vessel disease setting. First of all, we have clinical data obviously, but the study is not powered in order to have a definite superiority or non-inferiority of this device in terms of clinical endpoints. And the second limitation is that for the moment, we have the 1 year follow-up, which I presented today, but we will need at least a 2-year follow-up in order to see if these results will be maintained by DCB or if there will be a late catch-up phenomenon in terms of restenosis. This is a final answer when you should decide what to use in a small vessel disease. We know that if we use even the best-in-class drug-eluting stent in a small vessel disease, we still have a 10 to 12% target lesion failure after 1 or 2 years. That is too much. So now we have the data regarding the safety and the efficacy of an alternative to drug-eluting stent in this setting. We would need, like Roxana Meran, which moderated our session today, we would like to have a big randomized clinical trial with clinical endpoints, 1 devices, drug-coated balloon, latest generation drug-coated balloon, and 1 latest generation drug-eluting stent. We would like to have this, probably designing just 1 single clinical endpoint. That would be wonderful. It would be tough because we would need a 2,000 or 2,500 patient study, but that would be great.